the open conversation is something that's being looked at nationally as well as locally. It's a real opportunity to get your voice heard. We need to continue to focus to have this discussion, how staff value actually feeding back. But also, once they've fed back, they need to see that we are taking action as a leadership community on what they're saying.
What's impressed me about the conversation so far is the way the system has come together to really understand why people are feeling dissatisfied, what we could do to change and improve. It's really been so ambitious and embraced really, and such a good opportunity for staff to get how they want the future system to be and build something that we can all work together on. There's a real chance here for staff who are feeling maybe a little bit jaded, dispirited, to use their voice, get their views across and really make a difference, not only for them, for their colleagues, and really important for the people that we serve as well, to make it a good place.
Unless people come forward and tell us what will make a difference for them, we will not be able to respond. They're helping us to actually set the agenda to make it a better place to work in health and care in Birmingham and Solihull. It's a real opportunity to do that. You can do it anonymously, so there's no fear at all of any reprisal. And any idea, and we've had over 10,000 ideas last time, we will look at and we promise to look at.
Looking at the pledges, I think the biggest element that will make a difference to our staff is really around psychological safety. I think we've really come out of, even though it was a few years ago, a challenging time through the pandemic, and general practice has changed. We've had a huge influx of additional roles coming into the sector. Our physician associate colleagues, our paramedics, our pharmacists, hearing their voice as well as general practice and GP's voice is incredibly important, because we are one general practice family now. It's incredibly important to be involved in the second conversation. This is your opportunity for your voice to be heard in the context of your experience of general practice in Birmingham and Solihull. What you're saying has huge ramifications in terms of how our system, our health and care system, supports general practice and recognises its contribution to the wider system.
Right across the voluntary sector, there are people working hand in glove with people in the NHS and within local authorities. I think there's a broad recognition that care needs to be delivered across different organisations, and the voluntary sector's got a really important part to play. It's a real opportunity for staff and volunteers to get their voice heard and to shape the future. This is really the first time that the staff have been listened to across lots of different organisations to understand what specifically their needs are and what they're going to need going forwards. If we don't get it right for our staff, we won't get it right for patients. Our staff are really the most important part of our care, their skills, their approach, how well they feel supported at work. And in order to do that, we need to understand what they need and also plan for their future. And this is a really important part of that. In 5 years' time, I would expect a happier workforce. I would expect people to be much more easily able to move between different parts of the system. And I would expect better connections between the voluntary sector, the NHS and local authorities.
In 5 years' time, what I'd like to see, and probably where things are moving now, is more towards integration, working with our provider colleagues, working with system partners a lot more closely for a collective good. So we already see that happening really with general practice and with community. There's really good alignment with what we're trying to do in general practice with what our community colleagues are doing. Why can't we start having a conversation about working a lot more closely together to achieve better outcomes for our patients and our citizens?